Hey, what's up guys? So, it's been absolutely forever since I've actually successfully uploaded a video. I have actually recorded a few vlogs, but I don't remember which vlogs actually made it to the YouTube channel because my connectivity is absolutely shocking at the moment. So I live in like a semi-rural area. There's like a farm and a rural village within 15 minutes walk from my house. So I guess there's not a lot of choice with internet providers, and the one that we have is supposedly the best one, and yeah, it's just absolutely shocking. Since COVID hit and people have been working from home and people have been streaming loads of stuff all the time, it seems to have been worse. But yeah, yesterday I did a internet speed test and it was 5 megabytes per second both ways, and I paid for like 200, so I don't know. I've done all the checks, just to say. I have done everything I can to try and improve it. No avail. But anyway, that's a digression. So, I'm just going to recap because I can't remember when the last time I actually got to speak to you guys was. So I'm going to recap from basically Christmas to now because I can't remember. So around about Christmas I had like a really bad urinary tract infection, and I had to go, I couldn't get an appointment with my GP. So I went to the sexual health clinic because apparently one of my friends told me, oh, well, they deal with UTIs, and I was like, oh, cool. So I went there, which was really strange for me. I was like, this is like, because of being married for like a decade, it's like such a weird experience for me. But yeah, they were really lovely, and actually I used to work with the same department but in a different area. So it was a little bit awkward because I was like, hopefully I don't get someone I know. Anyway, they gave me these really, really, really strong antibiotics. I think it was Cefalexin, and I had like a 500 milligram dose 3 times a day, I want to say. Which is like the maximum dose, I think. And I basically got a really bad skin rash. So apparently I have a very slight penicillin sensitivity, and I do remember when I was a kid having like a skin rash reaction to amoxicillin. So I probably do have a very slight penicillin sensitivity. But nowadays in the medical world, they just, unless you are actually really severely allergic to penicillin, it's one of the better antibiotics, and we kind of just have to take what we've got. So they just give it to you anyway. But I'd never really twigged that I might have a penicillin sensitivity. Anyway, I had the goddamn screen. I had the penicillin. I don't know if this is turning off or not, so I'm just going to keep knocking it every few minutes because eventually I will actually get myself organised and get my proper camera out. Life is just really difficult at the minute. Anyway, so I had the antibiotics. I did get better. It was hell on earth. I was like a walking scab, itchy as hell. But anyway, the UTI has now gone. I then had to go and have an ultrasound scan of my urinary tract, so like my kidneys downwards. Everything apparently is fine, and you had to like have a full bladder. So I drank like 2 litres of water before I went. Like, they saw me really quickly, but I really hate that feeling of feeling like fit to burst. Is that a buzzard? Huh. See, that's how rural I live. It's like we randomly get birds of prey knocking about outside. Yeah, so I had to have that. I had to be full, and it was really uncomfortable because they like kind of push in your belly to scan you. And then I had to go and pee, and then they scanned me afterwards to make sure that I was emptying my bladder properly, which I was apparently. And they also noticed that my ovaries do not have signs of polycystic ovary syndrome, which is interesting considering I've been diagnosed with polycystic ovary syndrome. I have had ultrasound scans of my ovaries before, but that's interesting. Anyway, that's by the by. So the urinary tract infections have cleared up. So that situation is all done. I mean, I think that if I would have just had the proper antibiotics in the first place, it would have saved me 3 months worth of grief. But that's by the by. I mean, it can't be helped. Medicine's not always exact. Everyone's different, so it's really, I mean, looking at it from a nursing point of view, it is difficult to, not everyone fits the same mould, and that's what I always try to remember, is that not everyone fits the same mould, so I'm just a weirdo that couldn't get rid of my infection. And then after I had the ultrasound scan, I also had my MRI for my head, which was fun because apparently I am really difficult to cannulate. Now, I've always known, excuse me, like hiccuping, and not really burping, but hiccuping. I don't know why, but I had a migraine. Well, I've still got a migraine. And don't I have a migraine? But it was a bad one. So I think it's probably to do with that. What was I saying? Yeah, I had to have a cannula, and apparently I'm really bad at being cannulated. So I had 4. I had 1 here, which was the one they actually successfully got into me. I had 1 here, 2 here. Oh my god. So they said that if I have to go back and have any other cannulas or whatever, then I need to go to the elderly patients area because they've got like infrared devices to find your veins. It was, I mean, I'm a needle phobe as well, so I'm just sitting there like, because I'm completely fine with injecting other people. Like my doctor said, sadism only works one way. But having injections myself is a hassle. So yeah, I eventually got the cannula. I had a massive, like, swelling on my hand where the saline just tissued, and I was like, this is not nice, this is disgusting. I had the gallium stuff, which made me feel like absolute trash. So for about a week after the MRI scan, I was in bed and completely like, I don't want to live anymore. Yeah, it just made me feel really like trash. And I did actually have a look up at the side effects of it. And a lot of it was described as fatigue and general malaise, which is pretty much what I had. So, it was just pretty much a ramping up of the malaise and general fatigue that I have. So I didn't feel very well. It's taken absolutely ages for the report to come through. Like, it's been literally a month now. I only got the report yesterday as to what actually is going on there. Apparently everything is clear, which is great because I've been worrying for the last 3 months that I have a brain tumour. But never mind. So I'm glad that in a way, no, I am really, really glad that there was nothing sinister going on. But equally, I'm like, well, now I'm back at square one because I don't know no one knows what's wrong with me, basically. I've obviously got this primary headache disorder. I've also got several hormone imbalances, but nobody seems to know why and are they all connected. Pituitary was one of the options, but that seems to be working fine. I don't know. So yeah, I also saw the neurologist. So I've been having a bit of an ongoing sort of thing with work. So I've been off since September, mainly because like my migraines are so irregular and so difficult to manage that. Do you know what? I'm going to try and put this on full screen and see if it keeps the computer awake. So my headaches were so irregular and so difficult to predict that I ended up going to work. You know when you go to work on autopilot and you just sort of get there and then you sort of like grind to a halt and you're like, alright. So that kept happening. I think the last day I was actually at work, I'd got to work at 8 o'clock, I'd seen 2 patients, and then I started feeling really nauseated, really sick, and it was like I was drunk. So I phoned up and then I was like, and I couldn't even speak on the phone to my manager, and so I ended up going home, and yeah, so since then I haven't been at work. So a lot of the problem with my migraines is that they kind of give me this weird neurological issues that I can't function properly. It's not so much the headache, because the headache I'm kind of used to. I've had the headache for like a solid 18 months at this point. But it's the other symptoms that go with it. I don't know if that makes any sense to anyone that doesn't have chronic migraine. So yeah, work kind of want me to go back, obviously, but they don't want me to go back until they know that I'm not going to be going off sick every 5 minutes, which is really difficult when every single day I have a headache and my symptoms are really bad. I'm equally going really stir crazy being stuck indoors. It doesn't help that it's the middle of the pandemic, and you know, we were in the middle of renovating this room, and I've just seen on the video that you can see that I haven't got any coving yet. So, you know, everything's kind of ground to a halt. Oh, I know it has everywhere, but I don't think that really helps with my situation. So yeah, work were like, you need to sort of harass the doctors. So I did. And I managed to get my neurology thing in early December, and then they offered me general occipital nerve blocks, which is the general occipital nerve goes from like the base of your neck across here, and then you've got the trigeminal nerve that I think comes here, and it's called trigeminal because it has 3 prongs. So yeah, I had that done. I mean, I really put it off because personally, I didn't particularly want to have it done. I kind of got it done in a desperate attempt to, you know, get back to work, get myself headache free, trying to break the cycle. But it hasn't worked. It's been like 2 weeks now, and it hasn't worked. And I have this really weird bony kind of lump on the back of my head where I had the injections. So I think they injected lignocaine and some sort of steroid, and I can't remember what it was called. I have the letter somewhere. But they injected painkillers and steroid. And as I was needle phobic, I was like, this is getting an injection in my scalp. By the way, going on full screen did not work. Getting an injection in my scalp really didn't seem like the one. And I had it done. And I thought I was really brave for doing it. And then I had my COVID vaccination the day after. I thought, you know, 2 birds with 1 stone, get it all done at once, you know. So I was like, I can mope all week and then that's fine. Because I have to have a mope after having injections for some reason. I think it's just part of my coping mechanism. So I had a little bit of a mope, and oh my god, honestly, we went home via the shop when I had the COVID vaccination. I had the Oxford one, the AstraZeneca one. And I went to the shop, and then I was like, okay, cool. I was like, trying to keep myself busy because I was like disowning my arm. And actually the vaccine wasn't too bad at all. It didn't hurt really, and I was just like, carry on, you know. And then about 3 to 4 hours after I'd had the vaccine, I was like, I feel really cold. Like, we were in the garden, just sort of pottering around in the garden, tidying it up for spring, and I was like, my head feels really cold, like, because I still had like the lumps on my head from the day before I'd had the injections. So I was wearing like a hat in the garden, and I was like, okay, my head is like feeling really tight. You know, like when you feel really cold and your skin feels tight? It was like that sort of feeling. And I was like, okay, so I'm feeling really cold. I'm going to go indoors. I went indoors, and then like within probably about half an hour of laying down in bed to try and get warm, I was getting colder and colder and colder and colder and colder. And I was like shaking like I was having a fit. It was really bad. I mean, obviously, working in nursing, I've seen people have rigors, but I've never experienced it. I had proper full on rigors, like to the point where my husband was like, "You are actually shaking the bed so much that I can't even sit on the bed and comfort you. It's driving me insane." And I was like, "Yeah, well, I can't help you." Anyway, he went out and got like some full fat Coke because that seems to be the thing that helps me because it's got sugars and salts and electrolytes and all that jazz in it. So he went out to get that, and like while he was out, I just like ran a hot bath and stood with my feet in the hot bath, and I had like 10,000 blankets on because barely walk, by the way, because my muscles were spasming so much. And yeah, that lasted for about 8 hours, and I felt rough for 2 or 3 days afterwards. It's definitely worth it, but oh my goodness, that was a bad experience. I have noted that not everyone who has that vaccine has that reaction. I know about 2 or 3 people that have had that reaction, and most other people that have had it that I know have had that exact vaccine have had mild flu symptoms. That was extreme. Fever, rigors, really bad. Yeah, so that was how I felt that day, and it's been like 2 weeks now. I feel fine in relation to the vaccine. My head obviously still has that bony lump, so yesterday I spoke to my GP after 3 days of trying to get an appointment. You have to literally spam call the GP surgery and then wait in a queue for ages, and then you may get an appointment or they may all be fully booked, but that's by the by. I managed to speak to a GP and they were like, okay, well, the neurologist has said that, we need to change your medication, but I don't know what one to change it to, even though the neurologist said it in the letter. So she's asked the neurologist, and she told me that my MRI was clear, which is good. I did complain about the lump on the back of my head, and she's speaking to the neurologist about it. So that's where I am at the moment. I'm kind of like, I have a weird head. It's all like weird and bony feeling, and when I touch it, it's like I get like a shooting pain across that nerve. So I think now one of the side effects of the injections was lipodystrophy. So like it melts the fat underneath, the subcutaneous fat. So I think it's just the bones of my skull that I'm feeling. But my God, it feels disgusting. And I don't like, and at the moment, I did say to the neurologist this, pretty much anything touching my head or any pressure on my head or face is really affecting me. So even some days I can't wear my glasses because they hurt. I can't lay in bed because it hurts. I've had to find this bloody computer. I've had to find a really, really soft sofa cushion that I have underneath my bed pillow because my head it feels like a lead balloon. Honestly, it's so painful. Me touching my face even really sets it off. I've started getting the tingling back on the left side, which is bloody brilliant. Everyone wants a tingly face. So I just, at the moment, I don't know what's going to happen with my headache situation. Don't know what's going to happen with my job situation, because they were saying when I spoke to them last that they're giving me 4 weeks and then to see if the painkillers have worked, and then they're going to put me on a final, which means that I may or may not lose my job. So that's where I am at the minute. Ever since I had that conversation, I've been really depressed. Last night, my depression was really bad. I mean, it's not the only factor that's making my depression bad. I mean, COVID is a factor because I can't see any of my friends and all my parents, and the support network is delayed. So it's just me and my husband, and frankly, he's fed up of hearing about my headaches, and I don't like displaying pain in front of him. It's really difficult because he's going through just as much as I am by me being unwell, and I just don't want to put that burden on him, and it has put a bit of a strain on us, so it is difficult, and I don't know where life is going to go. I'm trying to remain hopeful, and just carry on. I have like meetings all the time with, people about my healthcare, and it's just, I'm getting to this point where I'm just like, I feel like being ill is a chore. It's really difficult. Yesterday, I mean, my head was so painful yesterday. I had to send a package, and then I came back, and then the opticians were like, "Oh yeah, we got your new glasses." I was like, "Oh, for God's sake!" So I had to go back out to the same place I'd just been to get my glasses, and it had taken me a real effort to get there in the first place because my head was so bad. Then I came back here, and I was like, "Okay, I'm going to move stuff upstairs, move stuff around because everything's just got jumbled where I've been off work and not like actually doing the decluttering of the house properly." Moved stuff around, and that took me about an hour, and then I was like, I am so dead. I went to lay down, couldn't rest because the headache was so bad that I couldn't relax. It was so agitating. And I just think like there's a lot of hidden stuff. I think I've got a close friend who is in a similar position to me. She's a very high functioning disabled person, and you kind of slip through the net. Like, you don't really get help, and you're expected to work, and in my case I've had to like struggle through working my entire adult life. You expect it, and it's come to a head where I'm now, well, the COVID masks, because the face pressure thing is really fucking up my day-to-day life. So both me and my friend have just got to this point where neither of us are really capable of holding down a full-time job, but we kind of need to because we don't get any help anywhere else. It's just really, I mean, I know it's a lot worse. I've got friends in the US where they literally get no help with their medical stuff, and at least in the UK, medical stuff is mostly free, at least at the moment. I've been asking for a psychologist for years, by the way. I've never actually seen a psychologist. I've just had antidepressants chucked at me. So if I can, at some point I'm going to pay privately to get a psychologist, just because I think there's a lot more going on with my mental health than just depression and anxiety, because I have a traumatic background. I'm sure that I have an element of complex PTSD in there. I did actually speak through this with my therapist, and they said that I displayed a lot of the signs of complex PTSD, but there's a lot going on, and I'm trying to set myself small tasks each day and trying to do them. It's just really difficult. Can I be asked sometimes? It's just a chore. Like, eating is a chore, sleeping is a chore because my head hurts and I put my head down. And I'm bored of Netflix, I'm bored of Disney Plus, and I'm bored of like all the films I've got at home, and I can't really read because my head is so bad. I can't really do my sewing because I have kind of ensconced my sewing machine in amongst a load of crap and I can't function to organise it. I'm just bored and fed up and ill. And the worst thing about it, absolute worst thing about it, is I don't look ill. I don't look depressed. I don't look like I'm in pain. I don't look disabled. But I am all of those things. I just don't look it. So people are like, oh, you're faking it. I'm not faking it, mate. If I had a choice, I would not be this way. I would be normal. But what is normal? I don't know. Anyway, I've rambled at you for 25 minutes now, which is a really long time, but it kind of makes up for me the lack of release that I get from doing vlogs for the last 3 months, where my connectivity has been shocking. I am fully expecting this video not to upload as well, so we shall see. Adios. Bye.